If you've been scrolling on TikTok recently, you may have seen videos encouraging users to get off of their hormonal birth control. Content creators are saying it's unhealthy and claim they feel and look better after saying no to the pill. This Wellness Wednesday, Dr. Natalie Gentili from Direct Care Physicians of Pittsburgh is sharing why you may want to think twice about taking medical advice on social media. Yeah, I mean, I think right off the bat, yes.
Yes.
Just because you've seen a video from someone saying it worked for them or didn't work for them doesn't mean you should automatically stop whatever you've been doing, right?
Certainly.
Yeah.
You know what really struck me about this whole issue is I think a lot of it comes down to mistrust.
This is the same conversation we just had in the newsroom. I'm so glad that you brought that up because I do think that, especially for women, we feel like we are not heard. So many times when we go to the doctor, our pain levels aren't heard, the problems that we're experiencing aren't heard. And so I think when we see other women saying, this is what worked for me, we'd rather trust the village of other women.
Absolutely.
Almost, right?
And we feel most comfortable with what is familiar to us. And the number of times I've asked someone, who's your doctor? And they can't even list their name, you know?
Right.
That's not a relationship. And with our broken healthcare system, that relationship has dissolved so much that we're going to what we feel familiar with. And for most people, that's social media.
Right. Especially now. So some of these videos are saying it's unhealthy, that they feel better. What's your take from hearing some of these things and watching some of the videos?
I don't think it's misinformation by any means when people give their own anecdotal experience, right? It's their experience. Certainly they may feel better. And I think that there's a lot of trend and drive toward natural, right? Like I want to know my cycle. I want to know the ins and outs of it, and I don't want something, you know, muddying the waters like a hormonal contraceptive. That's your body, right? And that's your choice.
Right.
Where I think it gets challenging is people are taking that as law, right? Like they're taking that as actual factual information that's going to apply to them. And I don't think we can make those broad generalizations.
You know, as a woman myself, going to a couple different OBGYNs over the years, I think that there's always this push to, your cycle's out of whack or this is going on, we'll just put you on birth control. It will be like the fix for everything that you're looking for. And I don't know that that's a one solution fits all kind of thing.
Agreed. It certainly does help a lot of people, and it does do that, but most of the time it doesn't really help us find underlying causes. And I think in 2023, more people are wanting to find underlying causes.
Isn't that so true? I think that's exactly it. I think it's that we don't want to just fix the problem. We want to figure out why it's happening in the first place.
Sure.
So let's talk about some of the benefits of hormonal birth control. Have there been changes to it over the years? Because, you know, I think a lot of us think, okay, well, is this the same birth control that my parents were taking, my mom was taking?
It's different. You know, I talk with my dad, who was an OBGYN for 45 years here in Pittsburgh, so he's seen things really evolve. And we were talking about, for example, in the pill that has estrogen and progesterone, the estrogen levels are significantly lower nowadays than they were, you know, when you and I were little kids, for example.
Right.
So they definitely are changing. And I think that it's a misleading name. Not everyone's using it for birth control. There are people who are dealing with really irregular cycles, like polycystic ovarian syndrome, for example.
Right.
Or there are people who are dealing with really bad hormonal acne that is, you know, debilitating for them.
Right.
The pill can be helpful for that.
Because it's really trying to level out where your hormone levels are. I had a conversation with another doctor, though, recently, and one of the things they brought up is that it's really hard to get a glimpse at what's wrong with your hormones. Because your cycle changes and your hormone levels change throughout the month. Is there a good way to see what's really going on with your body?
It's challenging, right? The majority of us in medicine have access to blood work, and we can check at certain points in your cycle to see if that lines up with where you should be. So that can be somewhat insightful, but I think also clinical symptoms are really insightful, and that takes time to figure out with patients.
Yeah, and so, okay, let's talk about some of the downsides to birth control. One of them, I know, right off the bat, they will tell you, is weight gain. And that could be something that is not something you're looking for.
Yeah, not everybody experiences that by any means, so I do want to make that clear.
Yes.
But some people do experience weight gain when they're on birth control. There's also the risk of unintended pregnancy if you don't take it consistently, right?
Yeah,
so
right, exactly.
We can't forget about human error and the risk of human error. There also is some slight increase of blood clot in some of our estrogen-containing contraception methods, and some people get nausea, bloating, you know, GI discomfort when they take it as well.
Okay, so things to look into. And also we've seen this kind of explosion of IUDs. And so there's differences in those too, and that could also be another form to use.
Yes, there are many different contraceptive methods we have nowadays, and I think it's super important to have an informed discussion about that.
But there really is this difference between information that you're seeing online and talking with your doctor. I mean, you could use that to kind of arm yourself with questions, but don't just take it as fact right off the bat.
I always say follow the money, because if you're looking at influencers that have a lot of followers and they're talking about certain products, they're likely getting paid. Nowadays, we as physicians can't get paid by pharmaceutical companies without disclosing that.
So that has to be disclosed.
There's got to be financial, drive around some of these things they're seeing on social.
Well, and that's one of the big things that's changed over the years too, because there was a time where doctors would get some sort of payout to push certain drugs, correct?
Sure, that was more common. And when I was in medical school, it was like, we couldn't even get lunches at medical school or any of the offices from pharmaceutical companies. It was done. So the Sunshine Act, you can look that up online. It's disclosed what physicians are getting money from what companies.
So there are steps in the right direction.
Yes.
Dr. Gentile, thank you so much. I hope that this helps some people out there who are maybe weighing the pros and cons, and especially about talking with their doctor about this. Thank you. And if you're interested in learning more about Direct Care Physicians of Pittsburgh or Rebel Wellness, we're going to have more on our website. You can just go to kdka.com/talkpittsburgh. Coming up on the show, dyslexia can take an emotional toll on kids struggling to keep up in class with their peers. The new program using artificial intelligence to help kids tackle the learning disorder.